Hey there, welcome back to our channel. Today we want to talk about something important: cancer symptoms that you shouldn't ignore. Cancer is a serious disease that affects millions of people worldwide. Do you know 1 in 3 people will get cancer during their lifetimes? And around 600,000 will die from it in the United States each year. But the good news is there are things you can do to catch cancer early when it's easiest to treat. In an effort to stay safe from coronavirus, many of us have put off the annual screenings and checkups where cancers are often caught. No matter your age or health, it's good to know the possible signs and symptoms of cancer. Although they aren't enough to diagnose the disease, they can provide clues for you and your doctor, helping to identify and treat any problems as early as possible. Remember, cancer treatment works best early on when a tumor is small and hasn't spread. That's understandable. Still, early detection is one of the best weapons against the disease. First, keep up to date with your cancer screenings. Screenings can detect a cancer before symptoms appear. You too can pick up on early warning signs by paying close attention to changes in your body. If you notice something new or different that lasts several weeks, then remember, several weeks is key. If you have any concerns, reach out to your healthcare provider. Not every symptom that could be cancer is cancer. Second, be aware of how your body looks and feels, and be on the lookout for changes. Cancer symptoms can be vague, and they can resemble other conditions or health concerns. But here are 17 symptoms that may warrant a call to your doctor. If you see or feel a new lump or mass that's been there for a few weeks or is growing, get it checked out. Many lumps are not cancer, and your doctor may be able to tell you right away. Sometimes more testing is needed. Maybe an ultrasound, CT scan, or MRI. Most adults do not lose weight without effort. So if you are losing weight without going on a diet or exercise program, talk to your doctor. Weight loss of 10 or more pounds that cannot be explained could be a sign of cancer. Stomach, liver, and pancreas cancers can all cause loss of appetite. Colon cancer can prevent the colon from properly absorbing food and nutrients, causing weight loss. Other cancers can cause mild nausea, which may mean you eat less. But weight loss is not always a sign of cancer. It could be that you have lost your appetite, or are skipping meals for other reasons like stress or depression. Second is pain. Don't ignore pain. If you have new and ongoing discomfort, get it checked out. But bear in mind that many cancers don't hurt. So if you have a lump that hasn't gone away, get it checked out, even if it doesn't hurt. Most breast cancers are not painful, and a growing mass that's not painful is concerning. Third is change in bowel or bladder habits. This can mean blood in the urine or stool, or changes in the stool. For example, your stool may be pencil thin or black. Any of these could be a sign of colon cancer. For men, urinating more often can be a sign of prostate cancer, because it may mean you are not emptying your bladder fully. Having more difficulty urinating also can be a sign of prostate cancer, although more commonly is it because of another less serious condition. For women, unless you're pregnant or drinking more water, urinating more often can be a sign of gynecologic cancers. Take note if you also feel full, have abdominal pain, and experience bloating. Not every urinary symptom is cancer, but if you are concerned or a problem is persistent after treatment, talk to your doctor or seek a second opinion. Number 4, fatigue. This is more than feeling tired after a busy day. Ask yourself, does my tiredness limit my activities? If you can't get out of bed to go to work or do something fun with friends, even if you seem to have had enough rest, that's a concern. There are a lot of other diseases that can cause tiredness though, so fatigue is not the number 1 symptom of cancer. Talk to your doctor. Number 5 is an ulcer that doesn't heal. It doesn't matter where it is. If you have a sore that doesn't heal, it should be checked out. Ulcers on the nipple can be a sign of breast cancer. And of course, sores on the skin that don't heal can be a sign of skin cancer. Inside your mouth, the ulcer might look like an area that is whiter and doesn't scrape off, or an area that's redder and doesn't go away. Both of those could be signs of oral cancer. Ask your dentist about oral cancer screening. Dentists can look for color changes and can also run their fingers all around your mouth to look for a mass. Number 6 is change in a mole or wart or any skin change. Everyone should be aware of how their moles, freckles, and warts look. That way, if anything changes, you can tell your doctor. People at higher risk of skin cancer should get a full-body skin cancer screening from their dermatologist every year. This includes people with fair skin and more than 50 moles, and also people who've been exposed to a lot of sun or tanning beds. If you have a family history of melanoma or a personal history of skin cancer, annual screenings are also recommended. Here is a full list of who is at higher risk of skin cancer. Number 7, any unusual bleeding or discharge. Seeing fluids where you don't normally see them can be a sign of cancer. If you are a woman, this could be vaginal bleeding or discharge different from what is normal for you. It could also be bloody discharge from the nipple. Number 8, indigestion or trouble swallowing. There are some benign throat conditions that can cause problems with swallowing, but indigestion or trouble swallowing also can be a sign of esophageal cancer. If you are having trouble swallowing, perhaps with pills or meat, talk to your doctor. If you've been having indigestion as well, that makes it more of a concern. 9th is nagging cough or hoarseness. A persistent cough or hoarseness can be a sign of lung cancer. Hoarseness can also be a sign of tumors on or near the vocal cords. Lung cancer kills more people than any other cancer. So it's important to watch out for these symptoms, especially if you are a smoker. How to talk to your doctor about cancer. Physicians will often allow a few weeks to see if your symptoms improve or get worse. Even if you think your symptoms are mild, don't hesitate to talk to your doctor. Remember, any ongoing symptoms should be evaluated, and be sure to follow up. Thank you for watching, and if you enjoyed this video, make sure to subscribe to our channel for more valuable content. Stay healthy, and see you next time.